The first confusion you will have as a medical student is the textbook to use for anatomy, for physiology, for biochemistry, for histology, for embryology. Hi, welcome back to my YouTube channel. Today I'm going to give this to all my subscribers, both new subscribers and then my returning subscribers. Thank you so much for subscribing to my YouTube channel. This flower is for you, please. So I'm going to keep it here for you. You can come and pick it, okay? From our list of topics, what we have today is the best textbook for preclinical. So today I'm going to be pointing out the textbooks that you need, and I'm going to be reviewing a lot of textbooks for you so that you choose the one that you can use and not just the one that every other person is hyping. We are going to start with anatomy textbook. So the first textbook is Choruzia, we have Last Anatomy, we have Kitmore Anatomy, and then we have Vishram Singh. So we'll start with the first one, which is the Choruzia Anatomy. Yes, this comes in volumes. I did not use Choruzia. I came across Choruzia because one of my classmates was using Choruzia, so I saw him using it. I just went through the textbook and it was nice. If you are starting, it will help you to love anatomy because of the simplicity of the textbook. Then the next textbook is Kitmore. I started with Kitmore. Kitmore is one very big textbook, and this is what most medical students normally buy, but then it contains a lot of information that you might not even be needing anyway, but it's big. People that used Kitmore said they enjoyed it. One thing about Kitmore is that when you are reading Kitmore, it's enjoyable. So for starters, Kitmore is good. I started with Kitmore. You can start with Kitmore, okay? It is study friendly because of the pictures, the color of the atlas, the letters are bold and nice, okay? So Kitmore is good. I started with Kitmore, but however, I stopped using Kitmore at a point when I've gained my ground in anatomy. I moved to another textbook, which I will be telling us about. So Kitmore is good. Choruzia is good for starters, okay? You can use these two to start. Then the next textbook I would like to talk about is Last Anatomy, and this is my textbook personally. I used Last Anatomy, and Last Anatomy is not a textbook I would advise beginners to buy, okay? Don't start with Last Anatomy. Reason is that Last Anatomy contains information in a very funny way. Like, it's number one is that it does not have headings, it does not have pictures, it is not study friendly, it contains a lot of information in a scattered way. So you must have gained your ground in anatomy before you start using Last. I started using Last in my 300 level. My lecturers, they recommended Last, and most of our MCQ questions were from Last Anatomy. That was why I got Last Anatomy. But then you can't study Last Anatomy without an atlas. So when you are getting Last Anatomy, make sure you have an atlas, okay? So Last Anatomy is not recommended when you are just starting to study anatomy, but recommended when you must have known how to arrange your work in anatomy, when you must have known how to source out for headings, because the headings are not outlined in Last textbook. You have to sort it out yourself, okay? Then for theory, I just discovered one, Vishram Singh. Yes, that one, I asked questions about that one, and then I discovered that this one is actually the best to use in preparing for your theory exams, okay? It's arranged, the clinical correlates very nice with diagrams and all. And for MCQ, please, your Last. And then one more textbook that you must have in anatomy is the Atlas, okay? Atlas for Human Anatomy, because that contains all the picture that you need. And when you are using Last, you need an atlas. Last atlas. So for embryology textbook, we have Ndebesane and then we have Sadler. So I used more of my slides for embryology because they were detailed anyway. Then I do go to Sadler for more information, and then Ndebesane is kind of not so detailed, but it's simple to read, it's small. But I think Sadler is the best when it comes to embryology. So get yourself Sadler, and then don't neglect your slide, because most of the slides are very detailed. However, embryology, don't neglect the power of watching videos while using those textbooks. Then for histology, we have Bessane histology, we have Jankara's histology, and that's the Jankara's is what most people used because it has an atlas. Okay, there is an atlas with the textbook, so it's the best for histology. However, I did not use Jankara's, okay, but I know that it's actually the best. I used in the Bessane. Reason is that in the Bessane is small and it's easy to read, like it's smaller, okay, and my slides were enough, okay. The Bessane is okay if you want something small and straight to the point, okay. For physiology, we have Sembolingham, that is Essentials of Physiology, and we have Guyton and Hall. We also have Gannon, and then we have Ezeilo Physiology, that's Nigeria author. So for Ezeilo, I did not use Ezeilo, but some persons in my class used it. I think it's concise. Okay, so for Sembolingham, Essentials of Physiology, I used this whenever I want to know how topics are arranged. Sembolingham is so nice for arranging your topics, like, but it's one thing about Sembolingham is that it's not so detailed, okay. It's kind of approach the topic in a peripheral way, but it's very nice in helping you arrange your work. Generally, I didn't use Sembolingham so much. I used more of Guyton and Hall, okay, but then I also used my slide, the videos, and all to make my notes and to arrange it well. Now, the next one is Guyton and Hall. Guyton and Hall is a very detailed textbook. The only thing is that you'll be lost in information, in the amount of information there, that you might end up with a lot of points that in the exam you will have so many things in your head, but you wouldn't know how to pen them down. For your MCQ, for your objectives, Guyton and Hall is the best. And after watching videos, you can go to Guyton and then feed yourself with more information that will help you understand the concept. If you can calm down and read Guyton and Hall, you will enjoy physiology. If you are not calm, please, if you're not the type that will start reading early, please go for Sembolingham. If you know that you are the type that likes studying towards exam, just go for Sembolingham. But if you want to understand the concept, go for Guyton and Hall. And for biochemistry, okay, I just have 3 textbooks in my mind: Lippincott, Vasudevan, and Chatterjee. Vasudevan was so nice for me during metab days, like their metabolism and the way they explained it. It was easier to understand and it was straight to the point. So I used Vasudevan for my metabolism, used Chatterjee for my chemistry aspect, like knowing the chemistry of carbohydrates, protein, lipid. You can just buy Vasudevan and use for everything, because Vasudevan is actually a very good textbook. Then Lippincott, I heard is nice, you can try it. Don't forget to use your slides, okay, your lecturer slides, and then don't forget to answer past questions. Don't forget to watch videos. Whatever textbook you are using, videos are magical, okay. Watching videos actually helped me more than textbooks. So at the point I was just going through videos. After watching a video, I answer past questions, answer MCQ question. I would just say that this video actually covered all MCQ questions I'm seeing. So what's the essence of going to textbooks? Okay, so please, whichever textbook you are using, try to watch videos. I talked about multiple encoding method in one of my videos, how to create multiple pathways in the brain. Thank you for staying to the end, and don't forget to like and subscribe so that you get a flower from me. This flower is for my subscribers. Thank you. Bye. Come and carry it home. Bye.